Hi, Dr. Jason West. I practice in Pocatello, Idaho. I do a lot of vitamin infusion therapies, a lot of ozone therapies, and the major autohemotherapy. I have a 25-seat IV room that I fill up twice a day, 25 in the morning, 25 in the afternoon, and the majority of them get, well, everybody gets some type of ozone therapy, but I probably do a good 15 to 18 major autohemotherapies where we pull the blood out, mix it with the ozone, and run it past the ultraviolet tube into the system. And it's probably my number one energy formula. So when people come in and they say, man, I'm just really, really wiped out, I'm tired, and I say, look, you know, this is kind of like the Energizer Bunny treatment, where we're going to actually charge up your system.
Hi, my name is Dr. Gary Gordon. I'm 79 years young, and I've been practicing medicine for 56 years. I was born sick, and at age 79, I'm finally enjoying pretty good health. And one of the many steps that took to get here is a very simple idea: ultraviolet blood irradiation. The simple idea that we could take your blood out of your arm, ran it past an ultraviolet lamp, and significantly change your health.
I am Robin Benson. I'm a doctor of oriental medicine for 22 years. With you name the infection, I've probably treated it. So anything from Hep C to shingles, various forms of the herpes virus, I can provide this great therapy, and it's been fantastic to have in my practice all these years, and I highly recommend it.
I'm Frank Cousineau, the president of the Cancer Control Society. We at the Cancer Control Society believe is an extremely beneficial tool. UBI is something that will help eliminate those in a very non-toxic, safe way to provide a patient a much better chance of surviving disease and restoring health.
Hello, I'm Dr. Margaret New. I'm from Australia. I practice in Melbourne. I've been in practice for, goodness me, about 35 years. My patients that come to see me can range from chronic fatigue syndrome to arthritis to heart disease and cancer. And certainly I've found using the combination of the ozone and UBI a real plus to my patients' improvement. I would encourage all practitioners to consider using this as almost first line now.
My name is Amber, and I had a stroke 16 months ago. It was a massive stroke, giant clot right up in my brain, and it went through the Broca area, which means all my vocabulary, all the English language, writing, reading, even math problems. I have a really hard time doing math problems, and my entire right side of my body was paralyzed. I've been doing ozone treatments with the UBIs, and it's made a huge difference. Ozone's the huge one, but my immune system has been shut down a lot. And so if I do the UBI, then I don't get sick.
We use the ozone with the UVBI technology in our clinic for a variety of conditions. Infectious diseases such as Lyme disease, issues such as cancer, and the results we're getting are phenomenal.
Hi, my name is Dr. Bridget McMonagle. I've been using the UV therapy for almost a year. I often add ozone to the treatment as well. I've had patients respond. I can give you several examples. Chronic fatigue getting better in 2 to 3 treatments by up to 70%. I've had Parkinson's conditions getting better. I've had exercise-induced asthma. The woman teaches spin classes, was able to throw away her inhaler. I've had high school acne resolve after 6 treatments. Chronic upper respiratory tract infections resolve after 3 treatments. I've only had 2 patients out of hundreds that haven't noticed a change. It's been one of the best things I've ever added to my practice. It really helps me be successful, and my patients trust me more because they're feeling better.
My name is Dr. Bob Esslinger, and I'm the owner and medical director of Reno Integrative Medical Center here in Reno, Nevada. I use UBI treatment as a major player in my protocols for treating cancer. I have found it to be a major contributor in strengthening the immune system, killing viral loads off, as well as killing cancer cells and providing a vaccine-like effect.
Rick Wilkinson, I'm an MD from Yakima, Washington. Years ago, I bought a German piece of equipment from Robert Rowan, a Umatron, which was a UBI piece of equipment. I always found it difficult to use. I think people were helped, but it was always challenging to use, and it was too much of a hassle, so we quit using the Umatron, and I kind of didn't use any UBI for a long time. But then when I met Tom, and I heard from friends of mine that they were using his equipment, I thought I needed to look at this again. We've purchased some of the equipment. We use the UBI in conjunction with ozone treatments. And we've seen very nice things happen with a lot of different people.
Hi, my name is Dr. Avi Herskowitz. I'm a Hopkins-trained cardiologist and immunologist. I'm currently professor of medicine at UC San Francisco. I've probably done over 1,500 therapies with UBI, and the concept that such a energetic therapy could have a system-wide effect was very, very intriguing. So I decided to look into it and begin using it to take advantage of its antiviral and antimicrobial effects. 2 treatments with UBI alone took the infection down to a degree that it was tolerable and quite effective and quite impressive. And I find that the combination of ozone and UBI is more potent than ozone alone.
Well, good afternoon. My name is Brad Weeks. I'm a medical doctor, having practiced 25 years up in the Northwest on Whidbey Island off the coast of Seattle. If this sounds kind of space age-ish, it's because it is. This is the medicine of the future. This is a safe and effective and non-toxic approach to helping people with a variety of illnesses. I find it easy to use, I find the system simple, and I find most importantly the clinical results to be very promising. I have a lot of grateful patients who love this technology. It's a foundation of our cancer protocols. So it's my pleasure to support this work.